I had the privilege here at ESC 2022 in Barcelona to present the final result at 15 months of the MASTER-DAPT study, whose primary endpoint has been presented last year in Amsterdam, actually, in 2021. Now, the study was about extending the follow-up from 1 year up to 15 months, and the reason why that was particularly interesting is because at 1 year, patients entered the so-called routine care phase, meaning that within 1 year, the protocol mandated specific intensity of antiplatelet therapy in the two study arms, whereas after 1 year, we allowed physicians actually to decide upon which antiplatelet therapy and how many to carry over. At 15 months, we did see basically a confirmation and, in a way, an extension of the result that we did see at 1 year, meaning that an abbreviated DAPT regimen was not associated to an excess of ischemic events in patients having received a short DAPT regimen, and still the bleeding risk, the bleeding benefit, which was noted already at 1 year, got even slightly greater and therefore confirmed. We also had the chance to get something extra information, which was really very interesting, more in the sphere of behavioral science. We look into the database and we try to understand why are physicians deciding upon DAPT duration versus discontinuation, or antiplatelet therapy continuation versus discontinuation in patients who have a concomitant indication to oral anticoagulation. And we realize that physicians are basically massively affected by the perception of the ischemic risk of prior ischemic events, but not by the bleeding risk or prior bleeding events. And that is something which is very sobering, because it seems that what matters the most for patients is avoiding bleedings, whereas that endpoint is not really very relevant to physicians. I think this result should make us think that we should increase our awareness towards bleeding as well.